In this video we are going to talk about 10 symptoms you have lack of vitamin D. So before starting this video, please like this video and subscribe to our channel for future updates. How can vitamin D insufficiency manifest itself? In its most severe form, rickets, or persistent and severe vitamin D deficiency in childhood, can cause growth delays and noticeable skeletal deformities. Today, rickets is uncommon, but it doesn't imply vitamin D insufficiency isn't. Moreover, 40% of Americans are vitamin D deficient. Vitamin D insufficiency is connected to osteoporosis, heart disease, diabetes, autoimmune illnesses, high blood pressure, and poor pregnancy outcomes. Therefore, the potential health effects of this epidemic are substantial. Are you D deficient? Most likely, you have no idea. Vitamin D insufficiency symptoms might be subtle, or perhaps non-existent, in the early stages, according to the Vitamin D Council. You may feel fatigued and have general aches and pains, but these symptoms are easy to overlook because they can be caused by a variety of factors. Do you have aches and pains? You can easily attribute them to the aftereffects of your most recent workout, or just to the fact that you are no longer 20. Do you feel tired? It's possible that you're not getting enough good sleep. Lindsay Obermeyer, MS, RDN, CLT, a registered dietitian nutritionist and owner of Your Time Nutrition in Portland, Oregon, said she had persistent joint discomfort and had labs done, which revealed her vitamin D level was 29 nanograms per deciliter, nanograms per deciliter, which is considered insufficient by certain criteria. Within a week of starting a daily dose of vitamin D3, her joint pain was gone. I had 2 different clients with the same symptoms, so I had them tested for vitamin D. Both were under 30, and after supplementing, they received relief from joint discomfort. It's a common occurrence in the Pacific Northwest. It's not always easy to identify when you're deficient in vitamin D. Here are 15 indicators that you may be lacking in vitamin D. Number 10. Chronic pain. It's possible that a shortage of vitamin D is contributing to chronic, widespread pain throughout your body. This link was uncovered only lately. Researchers began investigating the relation between chronic pain and a vitamin D deficiency in 2010. Low vitamin D levels have now been found to raise the risk of chronic pain, and supplements can occasionally help reduce it. So, if you're suffering from pain, consult your doctor about the best strategy to increase your vitamin D intake. If you wish to try a preliminary test to see if what you're feeling is the same as chronic pain, experts prescribe the following. Press your palms onto your breastbone, which is located in the center of your chest, also called your sternum. If you press down on that location and feel a searing pain, you're probably suffering from chronic discomfort caused by a vitamin D deficiency. Number 9. Cardiovascular disease. Cardiovascular diseases are cardiac illnesses that include, among other things, damaged blood arteries and frequent blood clots. Vitamin D deficiency has been linked to congestive heart failure, according to research published by the National Institutes of Health. Dizziness, heavy bloating, especially in the legs, breathing problems, and chest pain are some of the more visible cardiovascular disease symptoms. If you notice any of these signs or symptoms, you should see your doctor right away. Home tests for vitamin D deficiency are available if you want to make sure you're on the correct track. These tests will examine your blood and may indicate that you need to alter your supplements regimen. Number 8. Psoriasis. Psoriasis can appear as a scaly rash on the scalp or other places of the body. It is frequently inflamed by stress. Unfortunately, finding out you have psoriasis tends to cause stress too. Although a shortage of vitamin D is not necessarily linked to psoriasis, the vitamin is occasionally utilized in treatment. According to the Mayo Clinic, if you don't get enough vitamin D, your body will have a tougher time fighting psoriasis. Psoriasis has no cure, however it can be managed with medication. There are other ways to deal with psoriasis-related problems besides lowering stress and getting enough vitamin D. Medicated shampoos, for example, can be given to keep your scaly rashes at bay. There are other ointments, oils, and other therapies that may help relieve your psoriasis-related discomfort, depending on the severity of your problem. Number 7. Chronic infections. Vitamin D has been shown to affect over 2,000 genes in the human body, so it's no surprise that your immune system's strength is linked to how much vitamin D you consume. Your immune system is resilient and able to combat infections and illnesses when your body is processing a healthy amount of vitamin D. A shortage of vitamin D, on the other hand, can be harmful to your overall health and leave you prone to attacks, health problems, and worries. Vitamin D supplements are widely available, but consult your doctor to determine the best option for you depending on your specific health needs. Number 6. Infertility. Vitamin D insufficiency may play a role in the development of polycystic ovarian syndrome, PCOS, a significant cause of female infertility, according to new research. Acanthosis nigricans, which causes dark, velvety skin patches, is a typical sign of PCOS. We prefer to obtain a baseline on all of our patients in the reproductive world in the Northwest, and we see a lot of people who are deficient, said Judy Simon MS, RDN, CD, Chess, of Mind Body Nutrition in Seattle. Acanthosis nigricans was noticeable around her neck and on her chest in one young woman in her early 20s. She was pre-diabetic and had PCOS. The acanthosis was almost gone after 6 weeks of vitamin D administration, and she was much less tired. Number 5. Depression. It turns out that keeping a smile on your face is dependent on the sun. Because it is activated in your skin by sunlight, vitamin D is known as the sunshine vitamin. If you live somewhere that gets less sunlight than the rest of the world, the absence of light can practically ruin your mood. According to the Vitamin D Council, this crucial mineral aids in the production of serotonin in the brain's neurotransmitters, which influences our feelings of happiness. Low vitamin D levels have been associated to depressive episodes in studies. Depression caused by a lack of sun exposure is considered as a serious medical condition in Alaska and other places where there is much less sunlight for months of the year. Residents are encouraged to buy light boxes, which create therapeutic light and help people maintain their vitamin D levels throughout the dark winter months. Because the two can become dangerously entangled, it's critical to employ light therapy to treat depression induced by vitamin D deficiency. Light boxes come in a variety of shapes and sizes, and they can help you enhance your health. The Nature Bright SunTouch Plus Light and Ion Therapy Lamp, a bestseller on Amazon, balances your body clock, leaving you feeling rested, revitalized, and nourished all over, according to the Spurdy Vitamin D Light Box, which is the only recognized UV light box for vitamin D production. Although each type has the ability to help your health, if you require light therapy, choose one based on your goals. Number 4. Sweaty head. Doctors used to ask new mothers if their newborn's head sweated more than usual years ago. This can be a very early indicator of a vitamin D deficiency in a baby. If you're breastfeeding, it's a good idea to eat more vitamin D-rich foods or add vitamin D drops to your routine to ensure your kid gets enough. Fatty fish, such as tuna, orange juice, soy milk, and various cereals are among the foods that have higher levels of vitamin D. You'll also want to stock up on vitamin D-fortified dairy products, such as cheese. Don't be tricked into thinking that head perspiration caused by a vitamin D deficiency only affects children. If you're sweating profusely from your brow in conditions where you wouldn't typically perspire, you should seek medical advice. Number 3. Constant respiratory problems. Vitamin D has been shown in studies to help protect against respiratory infection, which is especially true in youngsters. If your child suffers from severe asthma, you should consider increasing his or her vitamin D consumption. Respiratory disorders that persist might manifest in a variety of ways. Someone with these problems may get easily exhausted after completing an activity that they would typically be able to complete without difficulty. It could be something as simple as trying to catch your breath for a lengthy amount of time. Breathing problems should be treated by a medical practitioner as soon as possible because they can progress to other problems. A person who has persistent respiratory issues is more likely to develop an anxiety disorder, such as panic attacks. The inability to take a full breath might soon turn into a panic attack that your life is in jeopardy. Number 2. Bone pain. In a study of 150 patients sent to a Minnesota clinic for persistent, general musculoskeletal pain, 93% had vitamin D levels of 20 nanograms per milliliter or less, which is deemed inadequate by most specialists. Your bones no longer develop as an adult, but new bone tissue replaces the old on a regular basis. The softening of bones known as osteomalacia, or adult rickets, which causes discomfort and increases the risk of osteoporosis, is caused by severe vitamin D insufficiency. Vitamin D deficiency can result from avoiding the sun and avoiding dairy, which can lead to bone pain. It can be difficult to tell the difference between this and muscle or joint pain, but it usually presents as a deep, aching pain that isn't localized. What are your thoughts on our video? Was above information helpful? Please let us know in the comment section below. If you enjoyed this video and would like to hear from me again, please subscribe and turn on the notification before leaving. Thank you for watching us.